this can also cause varicosities. Some forms of varicosities are seen as spider veins. They're seen just underneath the skin. They can be seen at any level of the body. Very often, varicosities, when they occur in the veins of the lining of the rectum, result in something called hemorrhoids. Hemorrhoids are varicose veins, and they're found in the rectum. Hemorrhoids are common in women who are pregnant and after they give birth, and the reason for that is increased intra-abdominal pressure prevents blood from going back to the heart. It actually stops the blood from going back to the heart effectively. We also see a very similar problem in alcoholics when they have swollen veins at the base of their esophagus. These veins also are varicose veins, and they are due to actually cirrhotic livers. When the liver is cirrhotic, it prevents the blood from going back to the heart, and the blood builds up in the veins just below. So it ends up in swollen blood vessels at the base of the esophagus. Now, that's varicose veins, swollen veins, and overstretched valves. There's another condition called phlebitis. You see the I-T-I-S, inflammation of, and then phleb refers to veins. If somebody is going to become a phlebotomist, they're going to learn how to draw blood, and you usually draw it from veins. So phlebitis is an inflammation of a vein.
Oh, yes.
No, phlebitis is inflammation that's pathology. A phlebotomist is a person, yes.
Yeah.
Take blood, yes. Take blood.
Yeah.
They work in the labs, you know.
They come to the floors, too.
Yeah, they do. They come to the floors and
for early morning blood draw, and they go to all the patients.
Some of them are actually going back to school to learn how to read electrocardiograms, or at least hook them up, you know. They get paid extra for that. So, a phlebotomist will withdraw blood, and an inflammation of a vein is called phlebitis. This type of inflammation can be caused by a number of things: trauma, sometimes disease. Some individuals have immune responses that actually result in inflammation of the lining of the vein itself. The problem is where you have inflammation, you have an increased risk of forming blood clots. And some medications can cause this. One thing that can cause it is birth control pills. And so you have to be careful, particularly above a certain age, and especially if your blood tends to form clots. Not a good thing. Not a good combination. Right? Now we saw before that the veins provide a great place to store blood when it doesn't have to be used for extra blood flow to the muscles, for example, during exercise. But here what I want you to look at is how blood is distributed in the body at rest and how it is distributed during exercise. And some things are very obvious. At rest, blood flows to the skeletal muscles, 1200. You start doing exercise, look how much blood flow increases to skeletal muscle. It increases by a factor of 10. Huge, okay? At rest, state of rest and relaxation, you got nice blood flow to your abdomen, to your gastrointestinal tract, digesting your meals. As soon as you start exercising, we have arteriovenous anastomosis, shunting blood away from the digestive tract, and we reduce blood flow to the digestive tract. Also the skin. We have a small amount of blood flow to the skin when you're at rest, but when you're exercising, the skin is very important for releasing waste products and sweating, loss of water. So we have increased blood flow to the skin. This is a form of temperature control. We also find that with exercise there's reduced blood flow to the kidneys. Okay. We have, of course, increased blood flow to the heart because your heart is actually beating more while you're exercising. But look at this one place right here, the brain. Look at the brain. This is the only section of the body that has absolutely no change in blood flow, whether you're at rest or whether you're exercising. See that? No change at all. No increase of because you need your brain, and the way for everything. You might not think so at all times, but you do. And it's important that blood flow be maintained to the brain consistently at all times. There's actually increased blood flow to other areas of the brain. Some areas, yes. I mean, within the brain, you might have something of blood, but going to the brain, always the same. Okay. All right. And here we can see within our brain, remember we had the cardiac center in the medulla oblongata to control our heart rate. We also have centers, what we call vasomotor centers, also in the medulla oblongata. This is going to control blood pressure and the distribution of blood. And what happens is signals, whether they're sympathetic or parasympathetic, depending upon what your situation is and where more or less blood flow is needed, signals will go from the medulla oblongata to the actual muscular distributing arteries and some arterioles to actually cause them to constrict. When the vessels constrict, blood flow to that area is reduced. Okay, but look at where we have exceptions here. Okay, look, yeah, genitalia is one exception, and also heart is a very important exception. Okay, so essentially, that is where our control is going to be. I'm not going to go through all of the whole thing. We just need to know that the control curve is going to be. Now, it's really important that all tissues receive the right amount of blood. That if they, let me just go, I don't want to go through all of this. So we not only have this vasomotor center controlling our blood pressure, but what if for some reason our blood pressure should increase in certain parts of our body? It could be due to an emotional state, it could be due to a disease process. Increased blood pressure can actually cause, in the end, decreased delivery of oxygen supply to different parts of the body. And we also have buildup. When you have decreased oxygen supply, you can have a buildup of metabolic waste products in that tissue. Now, when carbon dioxide levels build up in a tissue, when waste products build up in a tissue like lactic acid, there are receptors within your blood vessels that can detect the build-up of carbon dioxide and so forth. And this build-up of waste products, we see like carbon dioxide, can actually trigger the brain to alter blood pressure and blood flow. Okay? When there is a change in substances in the blood, like carbon dioxide or lactic acid, we call that a metabolic regulation. So we have a metabolic buildup of, these are the results of metabolism of glucose. You don't want to go through all of that. All this blood regulation. I do want to show you some of the things that happen when there's buildup of, for example, carbon dioxide. If your muscles are using up oxygen and glucose at a fast rate, and your blood supply isn't bringing in enough oxygen and glucose, then the metabolites will build up. You'll have a buildup of carbon dioxide and lactic acid. The presence of these metabolites will cause a reaction and cause vasodilation of the arterioles going into that area. When the blood vessel dilates, blood flow to that tissue increases. Okay, and what that will do is it will wash away all those toxic substances and bring in fresh oxygen and fresh blood flow. And you can see this. You can actually see the result of increased blood flow. There's a word for it. It's called hyperemia. Emia refers to blood, and hyper means increase or more than. So increased blood flow to a particular tissue or area is called hyperemia. And we actually see the results of this when you start exercising and you have increased blood flow to your skin. you can actually have a change in coloration of your skin. Okay, so hyperemia is easy-focused. You can also see an increase in carbon dioxide also causes dilation of coronary vessels. This is an important way to regulate or increase blood flow to myocardial tissues. Okay. Now, if your vessels to your heart cells are blocked, and you have decreased blood flow to the heart tissue, and therefore a buildup of lactic acid and a buildup of carbon dioxide, and the beginning of angina pectoris, because now you have ischemia, right? One of the things that the heart will do is it will try vasodilating those vessels because it wants to bring in fresh blood and get rid of those toxic metabolites. But sometimes it can't. And if somebody has ischemia, reduced oxygen supply to the cardiac tissue, one of the things that can be done for them is give them a particular medication, nitroglycerin. You may have heard of this. Nitroglycerin is a dilator of blood vessels. It causes vasodilation. So when you give somebody nitroglycerin and their blood vessels dilate and blood flow increases to the coronary, to the chest, to the heart muscle, to wash away those metabolites and bring in fresh oxygen, pain should go away. And that's one way that you could tell the difference between somebody who has just ischemia, angina pectoris, or if they're actually having an influx of heart attack. Okay. So nitroglycerin will do that, dilate. The effect of increased carbon dioxide in the brain also has an effect, but it's strange how increased carbon dioxide acts. When there is a small increase of carbon dioxide, all right, you're just having reduced blood flow, and carbon dioxide is just starting to build up, well then your vessels will dilate to try and flush out that carbon dioxide and bring in fresh oxygen. But what if your carbon dioxide levels have elevated too drastically? The brain, instead of having vasodilation, when you have too much carbon dioxide in the tissue, you will instead have vasoconstriction. And that's to prevent all that carbon dioxide from going to your brain tissue and destroying the brain tissue. Carbon dioxide has a particular effect. Carbon dioxide is highly acidic. So when you have elevated levels of carbon dioxide in your bloodstream, it causes your blood pH to drop down, to become lower, which means more acidic. And when your pH is acidic, it actually does a lot of things. It denatures proteins, so it changes enzymes so they don't work properly. It denatures proteins and hormones, so hormones don't work properly. It causes all kinds of problems. So this acidity is very bad, and in order to protect itself, the brain, when it detects certain levels of carbon dioxide, it causes vasoconstriction. This can actually cause people to actually pass out much sooner than you would expect when they have too much carbon dioxide in the bloodstream. Okay? It will actually first cause confusion, a lot of confusion and dissociative thinking, and then it causes people to pass out. And this autoregulation is very important for the body. Okay. Now remember I said that if lung tissue is damaged, if you had pneumonia and lung tissue is damaged, that the blood supply to that damaged tissue is going to be reduced. We see that here. If, for example, our lung tissue is not functioning properly, we will have an arteriovenous anastomosis form. The actual blood flow to that area of the tissue will be reduced. And it particularly happens if there's increased carbon dioxide and decreased oxygen coming from that area of the tissue. Oh, this is interesting. This is actually a blocked vessel. Okay. vessel, actually, coronary, this is a block vessel. You can see the blockages here, black areas. Of course, maybe it's working. Here it is, circulation to the brain. Here's the narrowing of a vessel. This is the result of atherosclerotic and arteriosclerotic disease. Remember, we had our common carotid artery. Here it is branching or bifurcating into an external and internal carotid artery. And we can see, because we put a dye into this vessel, and so we can see how blood is flowing through it. And we can see a narrowing of the vessel space right here. And that's due to a large plaque. And then, just beyond it, and of course that's the internal carotid artery, that's going to our brain. Just beyond it, another plaque has become arteriosclerotic and has formed an ulceration. These are the kind of things that form. This can happen not only in coronary vessels, but also in the carotid arteries. And of course, this is delivering decreased blood to the brain because of those plaques.
That's what Alzheimer's is?
No, Alzheimer's is a totally different problem. That has to do with damage to actual neuron cell bodies.
This is calcification.
It actually causes what they call neurofibrillatory tangles. They're like, it's almost like plasticized. It's like some of the neurons turn into plastic. It's very strange. And they stop producing the neurotransmitters that the brain needs to function, to get memory loss and so forth. But yeah, we get shrinking of the brain. But it's not due to
3 new drugs that they're in the process of testing right now. You know, are hereditary, right?
You know, it does seem to pass along in families, but nobody's sure why. If it is actually a genetic thing or influenced also by environment to some degree. Now, here's a circle of Willis, and even if there's blockage in a carotid artery, you know, bringing blood into that circle, because all of these vessels are connected, if there is some type of blockage to the vessels on one side of the brain, blood can actually circulate around the circle and to the other side. So there is what they call collateral circulation. That is an alternate method of blood to get to that tissue, collateral circulation. Okay, so that. Okay, we have two small types of circulation to look at now. One is fetal circulation, and the other is called hepatic portal circulation. All right. With hepatic portal circulation, it refers to the venous return. Remember, blood coming down our descending abdominal aorta, and then there was a first branching off the abdominal aorta called the celiac trunk. Remember that? And then one branch went to the spleen, splenic artery, and another branch went around the stomach, gastric artery, and another branch went to the liver, hepatic artery, right? So brought blood to all these areas. And you went further down the aorta, and you saw a branching off the aorta going to the small intestine, the superior mesenteric artery. You also further down saw the inferior mesenteric artery going to the large intestine. Okay? So all of these structures, the small intestine, the large intestine, the spleen, the liver, the stomach, they all have blood through their venous return having to return to the heart. But they do it in a special way. And we call that the hepatic portal circulation. Instead of having the splenic artery and hepatic artery and the mesenteric arteries just come back and drain into the inferior vena cava, instead blood from the spleen and the intestine need to go through the liver first. And the reason is because the liver is going to detoxify our blood. It's going to filter it and detoxify it. It's going to remove nutrients and substances that have been picked up by our small intestine digestive processes. It's going to remove blood cells and lymphoid cells, macrophages that have engulfed bacteria coming from our spleen, part of our immune system. And it's also going to remove old, damaged, dying red blood cells from the bloodstream and reprocess them, reprocess their components. That's what our liver does. And so in order to do that, it must receive the blood from the small intestine and from the spleen, and it does it by having all of that blood from our superior mesenteric vein, from our inferior mesenteric vein, from our splenic vein, drain into a special vein called the hepatic portal vein. So this hepatic portal vein will go to the liver, and then the hepatic portal vein will branch into many, many small little capillaries, eventually capillaries. These are going to be sinusoidal capillaries. And here, our blood will be filtered, cells will be removed and recycled and so forth. And then our filtered blood will be dumped into the hepatic vein, and from there into the inferior vena cava into our heart. So what's important about hepatic circulation is to understand why we have it, okay, to filter the blood coming from the intestines and the spleen. It's also important to understand the pathway. So make sure you know your pathway. It's going to go, you should write it down somewhere, from our superior mesenteric vein. So we've got from our superior mesenteric vein, our inferior mesenteric vein, and our splenic vein. Okay. And that's going to be from our small intestine, large intestine, and spleen. These are the most important components. Okay. All of these are going to empty into the hepatic portal vein. Okay. Hepatic portal vein will go into the liver. Eventually, sinusoidal capillaries. This is where we're going to have our blood filtered and detoxified. That detoxified blood will then be dumped in all of these sinusoidal capillaries and will be dumped into our hepatic vein. And from our hepatic vein, all that blood will be entered into our inferior vena cava, and that will go to the heart. In fact, it will specifically go to the right atrium of the heart. Okay? Right side of the heart. Alright? So make sure you know your pathways for our hepatic portal system. Okay? Very important to take all of this blood and filter it. And remember, our intestines, not only does it do the digest material, that the liver actually needs that material, some of the work that it does, but also in our intestines, particularly our large intestine, we actually have bacterial colonies. They can find their way into the bloodstream, so we need to take care of that. Also, our spleen, it removes macrophages that contain viruses and bacteria. We need to deal with that stuff. So that's what our liver does. It takes waste, toxins, digestive end products, etc., and processes. The liver is processing those. It also recycles red blood cells, certain white blood cells. Okay. Here we can see, I love Netter's drawing. Or anatomical drawings, so helpful. Here are the hepatic portal veins tributaries. You see the liver right here. We flipped up the gallbladder, so that green pouch right there. So you can actually see the hepatic portal vein going into the liver from underneath. And you can see this, what's contributing to that hepatic portal vein. We actually have our superior mesenteric vein coming from the small intestine, the inferior mesenteric vein coming from the large intestine. Here's our splenic vein. Now, look at what's joined by our splenic vein. It's joined by small branches from the pancreas. We also have some blood being brought in from the stomach, from our gastric vein as well. So those are also added in. And all of that blood goes into the hepatic portal vein and is brought into the liver. Okay? Now, once it's spread out into sinusoidal capillaries, the blood is filtered and detoxified, and it's dumped into the hepatic vein, and from the hepatic vein into the inferior vena cava. That's our pathway. Now, imagine if someone was an alcoholic and they had cirrhosis. Okay? Cirrhosis means that the liver tissue itself becomes very scarred. It gets filled with fatty deposits, and all of that shrinking and scarring and shriveling of the liver, pickling of the liver, actually prevents the blood from flowing into those sinusoidal capillaries and then into the hepatic vein. So what happens is the liver actually becomes a great blob of scar tissue, and it prevents blood from flowing up in that direction. What happens is all this blood that is accumulating in the hepatic portal vein is having difficulty getting through the liver and into the hepatic vein and the inferior vena cava. So there's a backup of blood. If there's a backup of blood in the hepatic portal vein, it will also start to back up along the gastric vein and even the splenic, these little pancreatic branches, and the intestinal, the mesenteric, small and large. And another place we're going to see it backing up. Look at the first branching into the hepatic portal vein. This one right here, and this one right here. These are the gastric veins. Look at what drains into those gastric veins. See this here at the top of the stomach? This is the esophagus. Esophagus going into the stomach. And all these little veins branching around the base of the esophagus, these are the esophageal veins. So if our liver is scarred and blood can't get through it, blood will back up. It'll back up into our gastric veins and eventually into the esophageal veins. And these veins will swell. And what will eventually happen is it will start to leak blood. The swelling is not just on the veins that are on the outside of the esophagus, but also lining the esophagus as well. Those are the esophageal varices you see in people who are alcoholics. And if that alcoholic should drink too much one day and then start to vomit violently, you can actually tear open those swollen veins, those varices, and have bleeding esophageal varices. Now, imagine also a person, say they have a normal liver, but they're pregnant. They're pregnant. And they have this growing fetus in their abdomen, increased intra-abdominal pressure, actually kind of preventing the blood under low pressure from going in that direction. And what that will do is cause blood to actually pool in the lower portions of the abdomen and pelvis. And look at where blood will end up pooling in our superior mesenteric tributaries and also the inferior mesenteric tributaries. One of the common things you see in women who are pregnant, particularly at the end of their pregnancy, is hemorrhoids, which are varices of the rectum. And here we can see veins that actually feed into the rectum, the ventral portion of the colon, and blood actually is forced back into these veins, which become swollen. After pregnancy, eventually they can shrink and heal, but that intra-abdominal pressure is what actually starts that whole process. Okay. All right. Finally, our last kind of circulation to look at, then we're done. Yep, then we're done. Is something called fetal circulation. Okay? Now I want to get the image of our... Again, with fetal circulation,